Everyone, and thank you for joining us for today's webinar, where we'll be discussing the best practices for biometric patient identification. I'm Dos Passos with Imprivata, and I'll be your host for today's session. I'd like to cover a few housekeeping items, and then I'll introduce our main presenter for today. First, I wanted to let our audience know that today's presentation is being recorded, and everyone who registered will receive an email with a link to the recording if you would like to listen again or share the information with your colleagues. I would also like to ask that any questions be submitted using the Q&A panel and not the chat box. We will do our best to address these during the Q&A portion of today's session, but if we don't have the opportunity to answer your specific question, someone from our team will reach out to you after the webinar with more information. So now, to get into the presentation, I'd like to introduce Rebecca Sliz, the Senior Product Marketing Manager for Imprivata PatientSecure.
Hello, everyone, and thanks for joining us for today's webinar. I'm Rebecca Sliz, and I'm excited to share with you some best practices for biometric patient identification. Before we really get into the presentation, I wanted you to consider this image, which is meant to help us think not about goldfish, but about change. Why change? What motivates people to change the way we do things to try something different or new? We are on a journey of change when it comes to the topic of patient identification in healthcare. Many people know there are problems with the way we identify people in healthcare today, and that the way things are done creates risks for individual patients as well as healthcare organizations. Yet, something is holding organizations back from changing their approach. As I go through this presentation, I encourage you to think about why the time for change is now and how you can help lead your organization in choosing a better way to identify patients. Let's start by grounding ourselves in the problem of patient misidentification, and then get into some of its impacts on patient safety and revenue flow. Then I'll introduce you to biometric patient identification, and specifically Imprivata PatientSecure. Misidentification starts at registration. According to a survey conducted by Ponemon Institute, 63% of respondents said problems occurred at registration. So despite many advances in technology, including the implementation of electronic health records, patient registration is still a manual process, or one that involves at least two human beings, the patient and the registration staff member or patient access rep. Because of the human nature of this interaction, many things can happen that can lead to the patient being misidentified. There can be language barriers or hearing issues, the patient may be confused, and staff are under pressure to check patients in quickly. Patient access staff are really the front line of patient identification, and frankly, they don't always have the best tools to do their job. Continuing with this person-driven process, if a registrar can't find the patient or has to choose from multiple records, he or she may just start a new record, a duplicate, or start entering information into a record that looks right, but isn't in fact the medical record for the patient standing in front of them, which results in the creation of an overlaid record. Once the patient is checked in and proceeds for care, the clinician now has to deal with the potential mismatch between patients and records, which may lead to duplicate testing performed on patients. Post-discharge, we pick up the duplicate record story again when a claim is filed with insurance against the wrong policy. As finance folks know very well, this can result in denied claims, which healthcare organizations then have to choose to appeal or to write off as bad debt. So hopefully those of you who are new to this problem now have a better appreciation for the various steps involved and the points at which things can go wrong. For those of you who may be familiar with the problem already, this visual may help you explain the problem to others in your organization who may not appreciate the challenges you deal with or the reasons why misidentification happens. So when talking about patient misidentification, I often use this widely accepted statistic that 7 to 10% of patients are misidentified when their medical record is accessed. Then I usually pause. The effects can be better in person than on a webinar, but I want people to fully appreciate that 10% of the time that you show up at a healthcare organization expecting care, there may be a patient matching error. Statistics like this sometimes get people's attention, but personal stories can help too. So here's a quick one from me. My last name is Sliz. It's not a very common last name. My dad is Ron Sliz, and recently he went to his GP, his general practitioner, for an appointment. A few weeks later, he got a bill for Richard Sliz. He noticed the discrepancy, called his doctor, and was able to resolve it. But it's just an example of how somewhere along this care continuum, or that care process for my dad, a misidentification took place. Some of you may be familiar with this example of Maria Garcia, which was documented by Harris Health System in Houston. You may or may not know that Harris Health is a user of Imprivata PatientSecure. Harris Health has over 3.5 million people in their database. In their system, there are almost 2,500 patients named Maria Garcia, and of those, 231 have the same date of birth. This situation is not really that uncommon, especially if you think about urban areas where there may be larger populations of people from similar backgrounds. Recently, I was at a health system in South Florida where the VP of IT had the last name Perez. And he commented that there are a lot of people named Perez in South Florida. So it can be hard to pull up the right record when you're a registrar under pressure. So now that we have an appreciation for the problem of patient matching, let's turn briefly to some of the implications of these errors. Generally, we think of two categories of implications, clinical and financial. With respect to clinical consequences, misidentification can result in patient harm. The ECRI Institute analyzed over 7,000 misidentification events and found that 9% resulted in some level of harm to patients. Many of you may be interested in or concerned about the potential loss of revenue that can occur as a result of misidentification. And the challenges with the registration process can also impact patient satisfaction in a number of ways. Patients may be annoyed with having to answer the same questions over and over, some of which involve sensitive or personal information, such as birth dates or social security numbers. They may get frustrated if the registrar can't immediately find their record, or if anything happens that means it takes longer for them to see a doctor. Patient frustration can manifest itself in lower scores on surveys like HCAHPS or other survey instruments. So while awareness of the extent of the patient identification problem and its impact may still be growing, the Joint Commission has recognized the need to improve patient identification as a key part of hospitals' patient safety initiatives. Continuing with the patient safety topic, here's a recent story of an individual affected by wrong patient error, which, according to Johns Hopkins research, is the third leading cause of death in America, medical errors. So picture a busy patient registration area. A new registration staff person checks the patient's driver's license and looks for the patient's name on the schedule. She sees what she thinks is the right name and creates a wristband. The patient then goes to an infusion area for chemotherapy treatment. Another nurse tries to verify his information and seems to get confirmation that the information is correct. However, an error was made. The patient received chemotherapy intended for another patient who had the same name but a different date of birth. A serious incident like this involving a patient can raise awareness pretty quickly of the importance of patient identification. So we've talked about some of the clinical implications of patient misidentification that can harm patients and hospitals' reputations. Now let's talk about some of the financial consequences. Duplicate medical records. About 10 years ago, the AHIMA organization had research that showed that the duplicate rate within an organization was about 8 to 12%. More recent research shows that that rate has climbed to about 18% duplicates within an organization, and across organizations it can be as high as 50%. Identity theft and insurance card fraud are also on the rise. Several years ago, the number of people affected by medical identity theft in 1 year was 2.3 million Americans. Today, people like the VP of IT in that South Florida health system talk very frankly about insurance card fraud being an issue in their systems. Misidentification also impacts claims. Multiple sources show that about 33% of denied claims can be attributed to misidentification, costing an average hospital a little over $1 million a year and our health system about $6 billion annually. So we've actually been talking for some time at Imprivata about the clinical and financial consequences of patient misidentification. A somewhat newer topic, but one that I see in the news pretty much every day, is patient experience. The advisory board has recently published several articles and infographics on this topic. The one on the screen here showing the impact on profitability of poor patient experience, which can be in the millions of dollars. Why is this? Well, one example is wait times. Think about if you've had to go to the emergency room with your child or even waiting in a doctor's office. Patients who wait may post negative reviews that spread quickly on social media and cost providers and systems new patients. So we've covered the problem of patient misidentification and some implications of the way that things are done today. Now let's talk about what can be done about it. And keep in mind how I started this presentation in talking about change and why it's important to change the way we routinely identify patients in healthcare. So we'll get into why choose biometric patient identification and specifically Imprivata PatientSecure. Recently, I came across a report on biometrics in healthcare, and there was such a good summary of the applicability of biometrics to healthcare that I thought I would share this little excerpt with you. From the report, it says, "The need to identify patients with a high degree of certainty is an increasing challenge for healthcare organizations. Identity verification solutions based on biometric technology can provide identity assurance and authentication while increasing privacy and security. And biometric technology can add operational efficiencies to the healthcare system that reduce cost and fraud and increase patient satisfaction by reducing medical errors." Pretty good sum. I couldn't have said it better myself, which is why I thought I'd share that report language with you. Here are a couple aspects or characteristics of biometrics that you may consider when you're looking at a biometric system. So the first is accuracy. A biometric system must be able to accurately match patients with no or very, very few false positives. That's imperative for healthcare. Permanency is another trait. So is the physical trait or aspect that's being used for biometrics stable over time? Applicability refers to whether everyone, all patients, can use the technology. And then adoption is, will patients use it? Will they be comfortable using it or not? So palm vein scanning is one biometric option offered as part of the Imprivata PatientSecure biometric identification system. Sorry about my slide advancement there. Here we go. Palm vein authentication is the most accurate biometric solution with accuracy rates approaching 100%. It's one of those 99.9999% accuracy examples. Your palm vein pattern is developed in the womb. The pattern grows as children grow, but stabilizes in young adulthood and is stable over a person's lifetime. Virtually everyone is capable of using the technology, and it has been well accepted or highly adopted among patients. And this may be because palm vein has no forensic value. So unlike fingerprints or even iris to some extent, palm vein patterns are not used by the government or law enforcement. Since my slides are already advancing, I'll move on to talk about how palm vein biometrics can also be very helpful in identifying unresponsive patients who may arrive in the emergency department. And this uses a feature in Imprivata PatientSecure called Trauma Search. I thought I'd share an example here of a customer of ours who, in the first year of PatientSecure usage, enrolled over 30,000 patients, authenticated those patients over 60,000 times, and they conducted 45 trauma searches. This is a situation where they had a Jane Doe or a John Doe in the emergency room, placed the person's palm on the scanner, and 28 times were able to identify the patient because those patients had previously enrolled in the system. So that's 28 people that were able to be treated correctly and with confidence by clinicians because they were able to identify those patients and pull up their medical records. Another biometric option that we offer at Imprivata is iris scanning. So this requires a special camera and the patients to look into that camera where their biometric will be captured. It's also a pattern recognition capture as opposed to a print. And the person's photo can be captured at the same time. So that's an efficiency that is different from the palm vein scanning, where a photo can also be captured via a webcam and attached to the patient record. One advantage of iris is that it's a touchless solution, so the person needs to lean forward to have their iris captured, but not actually touch the camera. So to address some of the concerns that have been expressed occasionally by infection control about touching the palm vein scanner, Imprivata has introduced some antimicrobial hardware components to our offering. So first, on the right there, you'll see a plastic piece that rests on top of the scanner. It guides the patient to where to place their palm, and that is made of antimicrobial material, which can also be cleaned. We also encourage patients to use hand sanitizer before they place their palm down. And in addition to that plastic piece that sits on top of the scanner, we actually now have an antimicrobial cup that holds or houses the scanner. So the entire hardware offering is now antimicrobial. And one use case where if the antimicrobial materials would be especially relevant would be a situation like radiation oncology, or other situations where patients have compromised immune systems and staff are concerned about the spread of infection. Imprivata PatientSecure is installed in several radiation oncology departments at New York hospitals, just sharing that example. So now that we've talked a little bit about biometric options, palm vein and iris, let's talk for a minute about why you may want to work with Imprivata to implement a biometric patient identification solution. One reason is that we understand workflows. So we have other products within our portfolio that have really enabled us to understand well clinician workflows, and increasingly we understand patient workflows within a hospital system. We also have tight integrations with other systems and technologies that would be used in the registration process, such as kiosks or other point-of-care solutions. And one other point on this side is that this shows the various steps in the registration process that could be streamlined with the use of biometrics, such as PatientSecure. So, just summarizing the main benefits that an organization may see when implementing biometric patient identification like PatientSecure. You'll notice that some of these benefits address some of the implications of misidentification that we discussed earlier in the webinar. So from the left, patient safety. Patient safety is really the number one consideration, and often the reason why organizations have been motivated to change the way they're doing things today and move towards biometrics. Not only does it help eliminate the creation of duplicate records and overlays, it can reduce medical error risk and help identify unconscious patients like in that emergency room situation. It can also help reduce identity theft and fraud, and can make patients feel more comfortable because they don't have to share their personal information as many times in the registration process. Patient identification, like PatientSecure, can help with revenue cycle efficiency. So there can be less of a need for duplicate record cleanup or the need to deal with denied claims. And finally, patient satisfaction. So there are examples where PatientSecure has helped systems with a smoother or faster check-in process, and that can help drive patient loyalty and retention. I thought I would just share a couple examples of customers of ours who have had success implementing PatientSecure. Starting on the left, we have Community Hospital Anderson in Anderson, Indiana. And there's quite a good video on our website that features senior leaders of the hospital talking about why they chose PatientSecure. The CEO states that basically, if PatientSecure saves one life, it will be worth the investment in the system. Centera, based in Virginia, also has a good story and a case study on our website, particularly about how they implemented PatientSecure in their emergency departments. They created what they call a pivot process, where the triage nurse and registration staff work together to register patients quickly. So if this all sounds good to you and you're thinking, yes, I'm interested in PatientSecure, what do I do next? I will share that one step that's critical is engaging multiple stakeholders within your organization. Patient misidentification affects many departments within a hospital, and it's often necessary to involve clinical leadership, financial leadership, also patient access, handling these situations day in, day out, and IT and HIM, people who deal with duplicates and duplicate record cleanup, in making your case for a solution like PatientSecure. We at Imprivata are certainly available to help you build the case for your organization and equip you to do things like create a need for budget for a solution like PatientSecure. Here's an example of some evidence that you can use with hospital leadership to make the case for PatientSecure. So earlier this year, we did a survey where 56% of respondents, and these were CIOs primarily, said patient matching is or should be a top priority of hospital leadership. So I think this is an interesting survey result in the sense that not only do CIOs think this is important, but they responded that hospital leadership overall should have this as a top priority. One other reason to consider partnering with Imprivata on a patient identification solution is that we can help with staff and patient buy-in. So let's say you're successful making the case, you're deciding to implement the system. We have, through our experience working with different customers, determined a couple key success factors to an implementation, which include internal training and awareness, some external marketing, and even a public relations effort. Patient adoption is critical. We have helped organizations organize enrollment fairs, both on-site as well as in other places in the community, to help patients get comfortable with the system. And all of those aspects have helped with solution implementation. With PatientSecure, the technology is just one piece of the solution. This is really about behavior change on the part of both patients and registration staff. As we alluded to at the beginning of the presentation, change can be challenging, and that's why we're here to help. So by working closely with our customers and providing value in a variety of ways, we have established ourselves as the market leader in biometric patient identification in healthcare in the U.S. So if you are interested in learning a little bit more about PatientSecure, seeing a video that I mentioned or case studies, I wanted to just point you to our website where there are some additional resources available. If you go to the resources page and search under patient identification, you will see a number of videos, case studies, white papers, etc., that will give you more information about PatientSecure. With that, I thank you for your attention, and I'll turn it back over to Anderson to see if there are any questions from the audience.
Okay, great. Thank you, Rebecca. So now to get to the audience questions. If you haven't yet, please enter your questions now into the question panel on the right of your screen, and we'll try to get through them as we can. So first question up here, Rebecca, is why can't we just use photos? Why do we need biometrics?
Good question. So there is certainly photos can be helpful, and there is evidence to show that when a photo is attached to a patient's record, it has helped clinicians make sure that they are treating the right patient. However, biometrics are far more accurate than photos. So when you are wanting to match, especially one patient to many medical records, the best way to do that is with a biometric solution.
Okay. And next question, how can PatientSecure help prevent fraud or identity theft?
Yeah, this is an issue that has come up in a number of customer conversations lately. And it's unfortunate but true, but that there are, a number of people who are trying to use relatives' insurance cards or situations like that where they may be trying to access health care or benefits that are not entirely theirs. So they may come into a registration desk and provide some incorrect information, but when they're asked to put their palm down, the palms don't lie, per se. So the hand really has it, and you can't substitute that. So when they put their hand down, the system will show whether they are, in fact, who they say they are and whether they are the person connected to the record. I've actually been in a situation where I've seen someone put their palm down, and it shows on the screen the message to the registrar that palm is associated with a different record. So clearly there's something going on there. The registration person does not have to address that situation immediately with the patient, especially if that patient may be difficult or challenging, but there is the opportunity to look up that record later and sort of dig into the problem more to see exactly what the situation is.
Okay, thanks. Another question here, how does trauma search work without date of birth?
Also a good question. And I think this is really interesting. So typically with PatientSecure, when a patient presents, we do ask for the date of birth just as a second factor of authentication and then place the palm down. When someone's coming in and they're unresponsive, they're not able to provide that information, either their name or their date of birth. So what the registration staff or clinician does is estimate that person's age by looking at them, and also can guess that person's gender. So we have a male, female, or other option. And the reason we have those characteristics or those inputs is to narrow down the database that the system will search when trying to identify the patient. So basically, once that information is entered, a gender and an estimate of age, and the palm is placed, the system will search, and that's how those 28 people at that customer site were able to be identified.
Okay. And another question following off the trauma search, do you have to have trauma search activated in all departments?
No, you don't have to. It's most frequently activated in the emergency department, and there's also kind of a double check. When you click trauma search, you're asked, are you sure you want to use trauma search? Because clearly the best way to find someone is, and the quickest way, is to be able to enter their date of birth and then scan their palm. But other departments where that scenario is less likely, they can deactivate or not activate trauma search. Okay.
All right, thanks a lot, Rebecca. That seems to be it from the questions over here. And I'd like to thank everyone again for joining us for today's discussion on the best practices for biometric patient identification. We'll be following up with any questions we did not get to during the webinar, and we'll also be following up with that email with the recording. Thank you very much for your time.